Today we are going to talk about something very important. We are talking about our kidneys. You know that the kidneys are the two tiny filters in our body that excrete the waste product out of the body. But what happens when some damage to the kidneys are there? So in this video we are going to talk about kidney failure. Causes behind it, because of which one normal kidney becomes abnormal and loses its function. We are categorizing the causes into pre-renal, intrarenal and the post-renal. These are the pre-renal causes, these are the intrarenal, and this is the post-renal. Pre-renal, intrarenal and the post-renal. In pre-renal cause, first is the hypertension. Because of the hypertension, the renal artery, especially the afferent arteriole, because of the renal artery, this afferent arteriole becomes thickened. This wall becomes thickened because of the high pressure, and the lumen size is narrowed. And when this lumen size is narrowed, because of that, the blood supply is also going to decrease, and the oxygen supply is also going to decrease. And when there is decreased blood supply and the decreased oxygen supply, because of that, the tissue is going to damage. There is ischemia is there, and because of that, there is glomerulosclerosis. The glomerulosclerosis is there, and when this is glomerulosclerosis is present for a longer period of time, it leads to acute kidney injury. And when this acute kidney injury is persists for longer period of time, then it leads to chronic kidney disease. At last, there is the end stage renal disease. There is a permanent damage to the kidney tissues. Right. Next is the diabetes. When the patient is having diabetes, this efferent arteriole is involved. Efferent arteriole is from where the filtrate is going to going to leave the kidney. This is in the efferent arteriole, same thing happens like that of the hypertension. This narrow lumen is going to have, because why? Here, what happens here, like this is the renal artery, this is the efferent renal artery. These are the proteins present on the membrane. These are the proteins, and the blood is present inside the glucose is present inside the blood. Now this glucose is going to stick to the protein. And because of that, this lumen become narrowed. Right? And when the lumen become narrowed, because of that, there is same thing happens. There's sclerosis is there, and when it persists for a longer period of time, then it leads to hypertension, and the sclerosis, ischemia is there always, because this condition is created here, because this efferent arteriole has become narrow. When this efferent arteriole is become narrow, what happens to all the fluid, all the filtrate is not going to come out from the glomerulus. Now there is high pressure is created in the glomerulus, and because of that, there is a glomerulosclerosis is there, and when it is persists for a longer period of time, and it leads to kidney. Next is diabetes. Diabetes is also one of the cause of this kidney failure. Now, what happens in diabetes? There is excess amount of glucose present in the blood. When there is excess amount of glucose present in the blood, it started to attach with the proteins on the membrane of the renal artery. This is the glucose, and it started to attach on the lining of the renal artery, and because of that, same thing is there. This lumen is going to decrease, and when this lumen is going to narrow, then there is the decreased blood supply and decreased oxygen. Because decreased blood and the decreased oxygen, there is decreased perfusion to the tissues, and there is the efferent arteriole is involved, from where the filtrate is going to leave from the kidney. So efferent arteriole is going to decrease, the lumen is decreased, and because of that, high pressure is created in the in the kidney, and when this high pressure is persist for a long time, it leads to acute kidney injury, and if it persists for a longer period of time, then it leads to acute kidney injury. This is all about diabetes, how the diabetes affect the hypertension. Now the postrenal cause. Postrenal cause are the BPH, like benign prostatic hyperplasia, the calculi, maybe any tumor. So these are the postrenal causes. Now coming to now some of the other causes that are there to cause that kidney failure. First is we have systemic lupus erythematosus, we have rheumatoid arthritis. Next is we have any NSAIDs. We should stop NSAIDs in the kidney patients, like ibuprofen. We are giving this naproxen. We are giving ketoconazole. Next is we are also there's something like untreated infections are there, like we are having HIV. If the patient is having HIV, right? And some of the antibiotics. Some of the antibiotics like vancomycin, gentamicin, these also causes the, and some of the contrast dyes. Some of the contrast dyes that also causes this kidney failure. So first we have this antibiotics. Next we have this untreated infections. Then we have SLE or rheumatoid arthritis. Then we have NSAIDs. Then we have the CT contrast dyes, right? So now about the symptoms. We know that kidney main function is to regulate the electrolyte balance in our body. If its kidney function is going to deteriorate, so the electrolyte balance is not maintained in the body. Here, the kidney helps to excrete the potassium. The main role is potassium excretion. Now the kidney function is going to decrease, so the potassium excretion is also not appropriate. Now hyperkalemia condition is produced. Now in hyperkalemia, the cardiac arrhythmias will be there. So we have to find out this thing. Now second is, so next symptom is hypocalcemia. Why hypocalcemia? Because the kidney main function is activate vitamin D, and when the kidney is activating vitamin D, there is increased calcium absorption. Here the kidney's function is deteriorating. Also because of that, the calcium is also not going to absorb, and the condition creates hypocalcemia, right? So we have hyperkalemia because potassium is not going to excrete from the body. We have hypocalcemia because calcium is not absorbing, because the kidney is not doing proper function, is not activating vitamin D. So there's hyperkalemia and hypocalcemia. And when hypocalcemia condition is created, the parathyroid gland activate. And when parathyroid gland activate, it absorb the calcium from the bones. And when this absorbing the calcium from the bones for a longer period of time, it leads to weak bones, because the calcium is excreted is reabsorbed from the bones. So the bones become weak. That is called osteodystrophy, right? Osteodystrophy because of the. So normal GFR is glomerular filtration rate is 90 to 120 ml per minute, and in a healthy patient. And we have the creatinine is 0.6 to 1.2 mg per dl, and this BUN is blood urea nitrogen is 7 to 20 mg per dl. Now these chronic kidney disease have the 5 stages. In stage 5, when GFR is less than 15, then it leads to ESRD. It is also called end stage renal disease, when there is decrease in the GFR to 15 or less than 15, right? And there is urine out. Okay, now you know that the kidney produces one hormone, that is renin. Whenever there is low fluid in the body, the kidney produces one hormone, that is called renin. Whenever there is decreased fluid in the body, then the kidney produces one hormone, and when this one hormone is produced, this increase the blood pressure. And when this blood pressure is increased, and already in a kidney failure patient, the hypertension is itself the cause of the kidney failure. Now this condition doubles. Here the things are going to double. Because of this renin, this BP is going to increase, and already in a hypertensive patient, hypertension is the cause of this kidney failure, and because of that, again there is kidney, again the kidney function is also going to deteriorate. So this produces a vicious cycle where all the things are going to increase the chances of kidney failure, right? Another hormone that is produces erythropoietin. Erythropoietin hormone is secreted by the kidneys, which helps in the production of RBC. And when the kidney function is deteriorated, erythropoietin hormone is also going to decrease. And when the erythropoietin hormone is going to decrease, there is decreased RBC level. And decreased RBC level means decreased hemoglobin, and decreased hemoglobin means the patient is now anemic. Right? Patient is having anemia at that. Now about the diagnosis. First of all, you have to check the GFR, glomerular filtration rate. By checking the glomerular filtration rate, you can diagnose at what stage this condition is. Now about the treatment. Treatment is managing the underlying cause is the only treatment. Then you finally you opt for dialysis and then the kidney transplant. These are the things, and in the next class in the next video I am going to tell you about dialysis, hemodialysis, what all the conditions and what all the complication in dialysis and the hemodialysis. So if you understood this topic, please hit the like button, and thank you so much.